Pulmonary embolism is a can't-miss diagnosis that provides a unique diagnostic challenge due to a wide variety of presenting symptoms which may overlap with other commonly diagnosed conditions like COPD or angina. Currently, the gold standard for PE diagnosis is the computed tomography pulmonary angiography, or CTPA, which provides definitive results but exposes patients to radiation, contrast dye, and increased healthcare costs. Worse, if a patient is discovered to not have a PE, they are exposed to all the drawbacks with none of the benefits. To better assist CTPA patient selection for suspected pulmonary embolism, we performed a retrospective study of 2,226 patients who received CTPA in the emergency department of an academic center. Using initial evaluation notes and discharge summaries, we documented several variables including age, gender, race, tests performed upon arrival, and any diagnostic procedures performed. Patients were then divided into groups based on their positive or negative CTPA result, and the frequency of each study variable was recorded. Each individual patient also underwent PE risk stratification using Well score, PERC rule, and the revised Geneva score. The graph displayed in Figure 1 represents risk factors present prior to receiving CTPA. Those with negative results are shown in blue, while those with positive results are seen in red. Risk factors found to be positively associated with PE include dyspnea, increased oxygen requirement, recent hospitalization, recent surgery, unilateral lower extremity pain, and unilateral lower extremity edema. Compared to their negative cohort, the PE positive patients were also more likely to be older, to have lower systolic and lower diastolic blood pressure, and to score higher on the Well score, revised Geneva score, and the PERC rule scores. Interestingly, chest pain and tachycardia were not associated with significant positive likelihood for the presence of PE. We also performed multivariate analysis, which concluded that increased age, decreased systolic blood pressure, increased oxygen requirement, and increased Well score are all significant independent risk factors for pulmonary embolism. In conclusion, our study demonstrates that several risk factors are associated with PE, most notably dyspnea, increased oxygen requirement, and recent hospitalization. Incorporating these results when selecting candidates for CTPA evaluation of pulmonary embolism may spare patients unnecessary radiation, contrast dye exposure, and can reduce total healthcare costs. Thank you.